Now coming to the cranial nerve, nuclei and column. So remember, there are two types of skeletal muscle in the head and neck region. First is which is derived from the pharyngeal arch, and the second type of muscles are those which are derived from stomach. That is stomatic muscle. So those which are derived from the pharyngeal arch are number one, first pharyngeal arch, second, third, fourth, and the sixth pharyngeal arch. Fifth arch disappears. First pharyngeal arch is supplied by the mandibular nerve. It is supplied by the mandibular nerve. That is the muscles of mastication. It is the muscles of mastication. The second arch is the facial nerve. It is the muscles of facial expression. Third arch is the ninth cranial nerve. It is the ninth cranial nerve. Fourth arch is supplied by the superior laryngeal nerve. Sixth arch is supplied by the recurrent laryngeal nerve. Both superior and the recurrent laryngeal nerve is a branch of vagus nerve. All these, that is the third arch, fourth arch, and the sixth arch, supplies the muscles of palate. It supplies the muscles of palate, pharynx, and larynx. Okay, it supplies the muscles of palate, pharynx, and larynx. Now coming to the muscles which are derived from stomatic, that is the stomatic muscles. The stomatic muscles are two. That is, number one is the extraocular muscle, which is derived from stomatomeres, and number two is the tongue muscle, it is derived from the stomites. Now coming to the neural tube, neural tube is divided into two parts, alar plate and the basal plate. This is the alar plate and this is the basal plate. Remember it, if you write B, this is the basal plate, AM will come, that is the motor, it is midline, and this is ventral, that is ventral. Alar plate, basal plate is motor, midline, and ventral. Alar plate is dorsal, sensory, and it is lateral. Okay, and the next thing which you have to remember is whenever the neural tube opens up in the brainstem, whenever it opens up, the alar plate will be moved dorsally. The alar plate will be moved. So this will lead the alar plate to go laterally, and the basal plate will be remain in the midline. So coming to the nucleus, there are three nucleus in the basal nucleus, which are efferent nucleus and the four nucleus in the alar plate. Now coming to the labeling, this is GSE, that is general stomatic efferent. This is SVE, this is GVE. Now coming to the mirror image, mirror it, that is GVA. Next is SVA. After that is GSA, and this is SSA. Now coming to the GSE is general stomatic efferent. That is the efferent. That is general sensation from the stomach. This is from the extraocular muscle and the tongue muscle. This is from the extraocular and the tongue muscle. Now coming to the SVE, it is a special visceral efferent. Viscera is nothing but those which are derived from the endoderm, which means that is the internal organs. That is the viscera is nothing but internal organs which are derived from endoderm. While stomach is nothing but those which are not derived from the endoderm, but it is derived from the ectoderm or the mesoderm. These are derived from ectoderm or the mesodermal derivative. Now coming to the next is, this is the nothing but stomach. So special visceral efferent. So pharyngeal arch muscles. Now coming to the GVE is the general visceral efferent. General visceral efferent are from the smooth muscles and glands. These are from smooth muscles and the gland. And this column is a parasympathetic column. This is a parasympathetic column. Now coming to GVA. Now go in the mirror image form. GVA is general. It is a general visceral afferent. That is the general sensation coming from the first word. Remember, the first letter in the afferent column always explain about the type of sensation, and the second letter explains about from where it is coming from. These are coming from. So if you take the coffee, if the coffee is hot, then this is the general sensation coming from GVA. If you tell the taste of the coffee, whether it is sweet or not, that is the special visceral afferent. That is the special sensation. Now coming to the next is SVA. This is the special visceral afferent. Special visceral afferent tells about the taste. Now coming to the GSA, it is the general stomatic afferent. It is the general sensation from body wall. That is the trigeminal, because of this is from the trigeminal nucleus. Now coming to the SSA. This, remember, it is from the viscera. Viscera is nothing but internal organs which are derived from endoderm. So remember, SSA is not endodermal. These are the special sensation which is not endodermal in origin, like the olfactory which is ectodermal, and the vision. This too doesn't have no nucleus present. And the nerve third is the hearing and balancing, which is from the eighth cranial nerve. It has two nucleuses, that is the vestibular and the cochlear nucleus. Vestibule and the cochlear nucleuses. Now let us draw it in the tabular form. GSE, SVE, GVE, GVA, SVA, GSA, SSA. This is the midbrain, pons and medulla. Midbrain, pons and medulla. In this GSA, GSE is the extraocular and the tongue muscle. These are the extraocular and tongue muscle. Third cranial nerve and the fourth cranial nerve. This is the sixth cranial nerve and this is the 12th cranial nerve. So 3, 4, 6 and the 12th cranial nerve. Now coming to the GSVE is from the pharyngeal arch. These are the skeletal muscle from the pharyngeal arch. This is 5, 7, 9, 10, 11. 9, 10 and 11. So 5, 7, 9, 10 and 11. This is called as nucleus of ambiguous. So remember why the 11th nerve? Because of VAC, that is vago accessory complex. The cranial part of accessory nerve goes join along with vagus nerve to supply what? Palatine pharynx, to supply the palatine pharynx. So whenever there is a damage to the nucleus of ambiguous, whenever the nucleus of ambiguous is damaged, what will happen? It will lead to unilateral ipsilateral. It will lead to ipsilateral bulbar paralysis. It will lead to bulbar paralysis. Ipsilateral bulbar paralysis. Except the tongue muscle. The 12th is the safe. The tongue muscles are not paralyzed. If they are not paralyzed, while has loss of gag reflex is also seen. Why? Because the 9th and 10th cranial nerve is involved. So bulbar paralysis, ipsilateral bulbar paralysis, not involving the tongue muscle, along with loss of gag reflex because of 9th and 10th cranial nerve damage. So remember, the spinal accessory nerve is supplying the palatine pharynx, but it is via the vagus. So when we see, as though it looks like the vagus is supplying that part. Now coming to the GVE is the parasympathetic. This is the parasympathetic, which supplies the smooth muscles and the gland. This is Edinger. This is the Edinger-Westphal nucleus. Edinger-Westphal nucleus, that is the third cranial nerve. Now coming to after third is the 7th cranial nerve, superior salivatory nucleus, 9th cranial nerve, inferior salivatory nucleus, and the next is the dorsal nucleus of vagus. This is the dorsal nucleus of vagus. This is the dorsal nucleus of vagus. Now coming to the GV and SVA, both have same columns because it is carried by the same nucleus. This action is carried by the same nucleus, which is the nucleus of tractus solitarius. This is 7, 9 and 10th cranial nerve. This is nucleus of tractus solitarius, where the cranial part is for the special sensation, and the lower part is for the general sensation. Now coming to the GSA, it is GSA. Remember, this is the three parts. That is the one is the mesencephalic nucleus, this is the chief nucleus, and this is the spinal nucleus. So remember, this is the spinal nucleus. SSA is the special sensation, not an endodermal in origin, not an endodermal origin, not from the endodermal origin. If it is an endodermal origin, it will goes into SVA. If it is not an endodermal origin, it comes to SSA, that is special stomatic afferent. This is the vestibular and the cochlear nucleus. Now coming to the next is the GVE column. Now coming to the GVE column, remember the Edinger-Westphal nucleus supplies the sphincter pupillae. It supplies the sphincter pupillae. Remember, it supplies the sphincter pupillae and the ciliaris muscle. Remember, sphincter muscle is a circular muscle. It is a circular muscle. Remember, the dilator pupillae is, that is alpha 1. Dilator pupillae and R, that is the radial muscle. These are radial muscle. These are supplied by the sympathetic supply. Whereas the sphincter pupillae and ciliaris is what? It is an parasympathetic supply. It is an parasympathetic. Superior salivatory nucleus supplies the submandibular and the sublingual. It supplies the submandibular and sublingual along with the lacrimal gland. While has the inferior salivatory nucleus, it is via which one? That is the 9th cranial nerve. It supplies the parotid. It is supplied by the parotid. Superior salivatory nucleus is from 7th cranial nerve. Now coming to the Edinger-Westphal is the 3rd cranial nerve. Now coming to the dorsal nerve of vagus, dorsal nucleus of vagus. It supplies the body wall. It supplies the smooth muscle. It supplies the smooth muscle and glands of thorax and abdomen. Okay. Now coming to the, remember, there are two things which we have to remember is the parasympathetic outflow. Parasympathetic is a craniosacral outflow. It is craniosacral outflow. Cranio, remember, cranio is 3, 7, 9 and 10. 3, 7, 9, 10. Sacral is S2, S3 and S4. Craniosacral outflow. And the sympathetic outflow is thoracolumbar outflow. That is T1 to L2 outflow. Okay. So the parasympathetic column is which one? GVE column is a parasympathetic column. Now coming to the trigeminal nucleus. It has three parts. One is the mesencephalic nucleus. Which is responsible for the jaw reflex. That is the proprioception. Okay. The second nucleus is the chief nucleus or a principal nucleus. It is the thickest part of the nucleus. It is the thickest part of the nuclei, cranial nuclei. Now coming to the spinal Spinal fat because it extends till C2. It is present both in pons and medulla. It extends both in pons and medulla, responsible for pain and temperature. It is responsible for pain and temperature. Now coming to the mesencephalic nucleus. The nucleus of jaw reflex. It is responsible for the jaw reflex, and any monosynaptic reflex. That is the deep tendon reflexes, monocephalic reflexes, which are deep tendon reflexes, deep tendon reflexes like ankle reflex, knee reflex, jaw reflex, and the biceps reflex. These are deep tendon. This is the only site where the pseudo unipolar or just unipolar neuron is present in the CNS. It is in the mesencephalic nucleus, while as in the peripheral nervous system, it is present in dorsal root ganglion and geniculate ganglia.